When Earl Williams was diagnosed with diabetes, he thought life as he knew it was over.
The first thing I did was panic. Back in the day, they used to call it that sugar. And when you had that sugar, it was like a death sentence.
On the streets of Chicago's South Side, you see men and women on the side of the road asking for money, often blind or with missing limbs, a telltale sign of diabetes. Williams, now 62, lost his health insurance coverage with his job. The future looked bleak. Then came the Affordable Care Act, Obamacare. The act expanded the Medicaid health care program for the poor to include more people, including him.
Obamacare affected me. It's really like a lifesaver between life and death.
Suddenly, he had a regular doctor and a team of specialists and access to a nutrition class. He lost 25 kilograms and his blood sugar levels went from alarming to nearly normal. It's not just the patient experience that's affected by Obamacare. This whole suite of offices at Woodlawn Health Center, a nutritionist, a case manager, a behavioral health specialist, and a referral expert are all funded through the Affordable Care Act. Now, Republicans in Congress have proposed repealing and replacing Obamacare. The new proposed law would also slash subsidies for the poor and working class patients like Williams. That worries his doctor.
It allowed him to have access to preventive services, access to primary care services, access to specialty services, along with medications. Anything that prevents persons from coming into the door is a problem, and it could basically result in bodies on the street.
Starting in 3 years, the proposed law would reduce the Medicaid funds Williams uses to get his care. That would leave him with less coverage, or if his state of Illinois drops the expanded Medicaid coverage entirely, with none. Without it, he says, he could not afford to pay the more than $500 a month it costs for the 7 pills he takes.
That's a critical point in my life that I ain't got to worry about. Without this Obamacare, you put my life, my community life, and my family life at jeopardy.
And we may have to look at a medication change.
If he loses coverage he can afford, Williams says, he'll have to seek care in the emergency room. Washington can pay for care now, he says, or pay more later. John Hendren, Al Jazeera, Chicago.